I find that speaking from my personal experience works well. I had a woman in the lobby and I said, we're giving COVID vaccines today. And would you like one? And she said, no, I don't want it. And I said, can I ask you why? She said, I've heard a lot of bad things about it. And I said, can I talk to you about my personal experience with the COVID vaccine? And she said, yeah. And I said, well, we've been dealing with COVID for a long time. I have seen 4 patients in this unit alone that have gone to the hospital and died from COVID. I've had dozens hospitalized with COVID. I have given thousands of vaccinations in the time that I've been a nurse in the units that I've worked in. Not one time have I ever seen anyone have a bad reaction to any of the vaccines that we've given within this unit, or have I heard about it in any other unit within our organization, and I would hear about it. I just kind of went into what I see, and she said, well, I hear a lot of bad things on the TV and on the internet. And I said, where do you get your medical advice from? And she said, I get it from my doctor. And I said, that's who you trust, correct? And she said, yes. I said, every single doctor within Northwest Kidney Center's organization supports vaccinations and wants you to get vaccinated, including your doctor. We know that it's the best for you and you'll have the best outcome if you get vaccinated. And her face changed. And I said, I'm going to let you think about this. And I'm going to talk to you on your next treatment and see what you think, but just kind of mull it over, talk it over with your family, think about what the things that I told you, and let me know. And she came back to that the next treatment, and I said, do you want to get it? And she said, yep, I'll get it. So, that's been very successful for me, just talking about my personal experience and talking about the doctors supporting it, and that they're real people. They're not internet people that, you don't know, that you don't trust, that you don't see. And so, that's been really successful for me. Also, when I have a refusal from a patient and I try to educate them, and they don't want to hear it, I say to them, okay, that's your choice, but I am going to have to notify the medical director of the facility, and I'm going to have to notify your doctor, and you may be getting a phone call from them. And then sometimes people's tone changes, and they're like, well, wait a minute, what am I going to be in some kind of trouble? Is it, it's like, no, you're not going to be in trouble, but they're just going to talk to you about getting vaccinated. I've had a lot of success with having, I'll catch doctors as they walk in the door and I'll say, Mr. White is refusing his pneumonia vaccine. Can you talk to him? The doctor will go over and talk to him. The doctor will come back to me and he'll say, Mr. White will get his pneumonia vaccine. And I say, okay. We go get the pneumonia vaccine. So, it's tapping into your team, using your personal experience.